Hello everyone, my name is Preeti. I'm a registered nurse. In today's video, we will gonna learn about metabolic acidosis. So let's get started. Whenever you see the word metabolic, think about kidney. This is the problem related to kidney. Acidosis means there is too much acid and less base in the patient's bloodstream. So what will happen in metabolic acidosis? The HCO3 will be less than 22 and pH will be less than 7.35. There is too much acid in the patient's blood and too little base. So how the lungs will compensate? As we learned in the previous video that opposite organ will always compensate. So in order to compensate, what the lungs will gonna do? The lungs will blow off extra more carbon dioxide. So patient will take deep and rapid breathing in order to blow off more carbon dioxide and maintain the acid base imbalance. Let's go over some of the causes that cause metabolic acidosis. So the big one is diabetes ketoacidosis. Diabetes ketoacidosis is the life-threatening complication of type 1 diabetes. What happen in type 1 diabetes? Patients do not produce any insulin. When there is no insulin, the glucose is not transporting from patient's blood to inside the cell. So the cells are going through the starvation. In order to that, there will be a breakdown of protein and fat to get the energy, and the end result will be accumulation of ketone and acid that will lead to diabetes ketoacidosis. Another cause we have is starvation. Same as DKA, when the cells go through starvation, when the cell does not have enough energy, there will be a breakdown of fat and protein that will lead to accumulation of ketone and acid. Kidney failure. If kidneys are not working properly, they will not excrete the hydrogen ion, which is acid, and there will be accumulation of acid and severe diarrhea. Also, if the patient have colostomy or ileostomy, and if they are draining too much, they will have metabolic acidosis. So what happen in diarrhea when the stool is base? There is a lot of base in the stool. So think like base come out of the bum. So base is coming out, too much base is coming out in diarrhea. So what the patient left with is acid. That's why patient will have metabolic acidosis in severe diarrhea or with colostomy or ileostomy if they are draining a lot. Some sign and symptoms. So the big one is hyperkalemia. Acidosis. So what will happen in acidosis? Too much acid in the blood. The H plus ion is the acid. So what will happen from the blood? The H plus ion will go inside the cell. And in order to make a space for the H plus ion inside the cell, the potassium will exit and go into the bloodstream. So we'll have high level of potassium into the blood, which is hyperkalemia. So patient will have a symptoms of hyperkalemia such as muscle twitching, weakness, and arrhythmia. So watch the patient for arrhythmia with metabolic acidosis. There will be a low blood pressure, confusion, and kusumal breathing. Respiratory rate will be high with the deep respiration. In order to compensate with metabolic acidosis, patient will have kusumal respiration, which is deep and rapid respiratory rate greater than 20 breath per minute. Why patient is taking rapid breath? To blow off more carbon dioxide in order to maintain the acid base balance. So what we're gonna do? What are the intervention? So metabolic acidosis, too much acid. So we're gonna administer base in order to increase the base level and maintain the acid base balance. So administer IV sodium bicarbonate. Take seizure precaution. Monitor the potassium level as patient will have hyperkalemia. Patient is at high risk for arrhythmias. DKA, if the patient is having diabetes ketoacidosis, administer insulin to prevent the breakdown of fat and protein, which will stop the ketone production. And if the patient is kidney failure, then dialysis will help to excrete the acid from the patient's body. Thank you for watching. I hope this video will help you to understand metabolic acidosis.